Hello, my name is Dr. Paul Orien. I am a Senior Clinical Advisor for Mental Health at the Center for Victims of Torture.
Hello, my name is Nuria Mihrabi. I'm a Senior Clinician and Clinical Trainer at S13.
Hi, my name is Sean Nemohan, and I'm the Team Leader of the School Liaison Program at the New South Wales Service for the Treatment and Rehabilitation of Torture and Trauma Survivors in Sydney, Australia. Paragraph 13 of the Global Standards on Rehabilitation of Torture Victims talks about the dissemination of information about torture and its effects to professionals in healthcare and other relevant fields who may come into contact with torture victims. This is something that is important in many aspects of our work at STARTS, and this video will discuss some of the ways STARTS seeks to do this through different aspects of our work.
At CVT, we see sharing knowledge as quite intertwined with our core rehabilitation goal of addressing mental health needs of torture survivors. In the project locations where we work, we always prioritize creating awareness and building capacities of healthcare, mental health, and social service providers to better and more appropriately serve survivors of torture and other severe trauma. Often at the onset of our programs and usually ongoing, we regularly conduct comprehensive surveys to allow an accurate assessment of survivors' needs and then to help in providing services that are responsive to those needs. Among other things, these surveys usually assess attitudes, stigma about mental health, current stressors, both psychological and physical symptoms, even assesses things like coping strategies, access to and barriers to services, and also demographic characteristics.
STARTS disseminates knowledge and fosters a positive recovery environment for torture and trauma survivors through offering a comprehensive training program as a part of this holistic approach.
We use these findings that we get from the surveys to inform our services, but as well ensure that the findings are disseminated broadly to a range of providers, organizations, and agencies. And this is because we see this as key to sharing relevant knowledge about survivors' populations in places where we work.
STARTS trained over 30,000 workers, volunteers, community members over the last 5 years to provide appropriate and culturally sensitive services for people from refugee backgrounds. This was achieved through provision of a comprehensive training program such as seminars, workshops, masterclass clinical evenings, training on request, online courses, owl talks, annual research symposium, as well as participating in a significant number of national and international conferences and publications.
Further, to help increase local knowledge about the effects of torture, war trauma, and promote awareness of rehabilitation and to engage local population in CVT programs, we prioritize as well community engagement and sensitization. The purpose is to involve the affected communities at large.
When I think of the standard of sharing knowledge, I think it is consistent with Kobler Center's approach to training and education and advocacy, but also to the evaluation of our treatment program, where we disseminate our research findings on outcomes at national and international conferences to professionals who work with survivors of torture. We typically present our outcomes findings in conjunction with the presentation of our treatment strategy, so the audience gets a sense of how we approach treatment and the services we provide. The findings we share inform these professionals about factors that can impact the well-being of survivors of torture while they matriculate through a treatment program. This enables the approach to rehabilitation to be constructed to optimize success by addressing specific needs.
In many places where CVT work, mental health services are often misunderstood by the target population. And this often leads to feelings of stigma when seeking services, or to even lack of community engagement in the services provided.
We began tracking clients' progress over a decade ago with 3 goals in mind: to demonstrate program efficacy to external funders, to gather information to improve the program internally, and to use the information to advocate for survivors of trauma and torture. We track clinical measures such as symptoms of anxiety, depression, and PTSD every 6 months for up to 2 years. We also track non-clinical measures such as immigration status, employment status, and housing status. This methodology is consistent with our holistic approach to care. It takes an integrated or wraparound approach to effectively treat survivors of torture.
Also key in our work is awareness, training, and capacity building of service providers. So to help them understand, identify or support or treat the specialized needs of survivors. And at CVT, we know that to sustainably provide care for survivors, all organizations involved need to understand the impact of torture and trauma and the effective strategies for working with this distinct population. Increased understanding of the needs of survivors can increase effectiveness in all sectors, even non-MHPSS sectors.
The team that I manage has the overall aim of supporting the psychological welfare of students, and the program helps make START services more accessible to young people with a refugee experience. With this goal in mind, we've been able to create and disseminate specialist content through our Hints for Healing platform, a website dedicated to creating practical resources, case studies, there's a podcast, professional learning videos, interviews, and research articles to support the educators and school counselors who work alongside young people with a refugee experience.
CVT thus conducts trainings to other agency staff on a range of topics, including raising awareness, self-care, stress management, even to more advanced trainings on torture and trauma-focused counseling skills.
This initiative is done in collaboration with other specialist teams at STARTS, most prominently our child and adolescent counsellors, our team of youth workers, and our early childhood practitioners.
At each follow-up, we also provide summaries to clinicians and case managers that allow them to address any issues and develop effective treatment plans. In sum, the IRCT standard of sharing knowledge is critical to the success of torture treatment programs, and the Kovler Center does their best to support this standard.
So this is just a little bit of what we do in relation to this paragraph 13 of sharing knowledge. Thank you very much.
Thank you.
Thank you.